So, Dr. Fauci, I want to talk about the, as we call them, vaccine hesitant. But before I do that, let's talk about the role of social distancing, mask wearing, some of the guidelines we had in getting those numbers back down in the United States, as opposed to the vaccines. To what extent was it the social distancing and the masks? And let's be honest, there's some confusion around the country right now about masks.
Yeah, I think the confusion is, and we've been discussing this over the past couple of days, David, is an understandable confusion. As the data accumulated as to the effectiveness, the real world effectiveness in vaccines in protecting you from getting infected, and even if you get a breakthrough infected, of preventing you from spreading it to anyone else, there was strong suggestions that that was the case. Over the last several weeks to a month, the data have become very clear that if you're fully vaccinated and an otherwise healthy person, the chances of your getting infected is remarkably low, really quite low. It's good against the variants, number two. And number three, even if you do get a breakthrough infected, the level of virus in your nasopharynx would be low enough that it is extremely unlikely that you would infect anyone else. Having said that, and documenting that, the CDC came out with guidance a few days ago last week and said, if you are fully vaccinated, you should feel safe that you can go without a mask, not only outdoors, but also indoors. That was directed specifically at people who were fully vaccinated. The problem is, David, that what happened is that people interpreted that that was a signal to say that you don't need masks anymore, which absolutely is not the case, because for people who are not vaccinated and still vulnerable and susceptible to infection, that you still have to follow the CDC guidelines that have not at all changed for that group. And that's where the confusion is. It applies only to people who are fully vaccinated.
So, Doctor, clearly it applies only to those fully vaccinated, and those of us who are fully vaccinated feel privileged to have that. But we don't know who's fully vaccinated. So if I'm running a business, whether it's a small retail store or it's a huge company, I don't necessarily know who's vaccinated and who's not. How do I figure out which is which?
Well, David, you just hit the nail right on the head of what the issue is. Since we are not centrally requiring proof of vaccinations, namely from the federal government on down, you gave an example which is a perfect example of what we're facing. So let's say I'm an owner of an establishment, whatever that establishment is, and I am aware of the CDC guidelines saying that if people who are vaccinated can feel safe outdoors and indoors without a mask, what I don't know is coming into my establishment who's vaccinated and who's not, which means you don't know who's infected and who's not, and what the risk of transmitting an infection within my establishment. And it's for that reason why there are some establishment owners and people responsible for the establishment who are saying, full understanding the CDC guidelines, if you want to come into my establishment, you have to wear a mask. And that's where some of the confusion is, David, because you're saying, wait a minute, the CDC is saying that if you're vaccinated, you don't have to wear a mask. And now you're telling me I have to wear a mask if I come into your... That's something that needs to be cleared up for sure. But what we are going to see, and we're seeing it already, is that there are organizations, particularly universities and colleges, who are saying, notwithstanding what the federal government is requiring, if you want to come into campus and be in-person learning, you're going to have to show proof of vaccination. Cruise ships will likely be doing that. Airlines will likely be doing that. So you're going to have at the local independent level things that the federal government is not going to be mandating.